Hi everyone, and welcome to our webinar, 35 Ways to Change the Food System. And today we'll be presenting the Essential Food Day Toolkit for Policy. I just wanted to take a moment to show you some of the features of our webinar system, and then I'll turn it over to our campaign manager, Lilia. My name is Catherine Castleman. I'm a project coordinator with the Food Day campaign. The system we're using today is GoToWebinar for those of you who haven't used it before. You can type any questions or comments you have into the dashboard you see on our screen, and we'll address them at the end during the Q&A session. We'll probably do that as opposed to pressing the raise hand button, since there'll be quite a few of you. And we are recording this session, so we'll send the link with the recording to all the registrants within about a week. And if you have any questions, contact us at foodday@cspinet.org. So today we'll be hearing from our campaign manager, Lilia Smelkova, Nancy Kuehnegarth, who is the president of Nancy S. Kuehnegarth Consulting and the longtime executive director of the New York State Healthy Eating and Physical Activity Alliance, Catherine Bishop, who's a nutrition policy associate at the Center for Science in the Public Interest, and Louise Mitchell, who is the regional organizer with Healthcare, Healthy Food and Healthcare Program with the Healthcare Without Harm. And then we'll hopefully have some time at the end for Q&A as well. And we just had a question come in. Yes, you will also be able to access the slides in the PowerPoint presentation. We'll send that link around with the recording. So now I'll turn it over to Lilia Smelkova, who is the campaign manager for Food Day, to give us an introduction to this initiative.
Thank you, Catherine, and thank you everyone for joining this webinar, and also for everyone who helped us to put these 35 policies together. Well, you know that Food Day is a nationwide celebration of healthy, affordable, and sustainably produced food, but it's also a grassroots campaign for better food policies. So we have been thinking since year one how best we can support their organizing on the ground with the resources and with the tools. And one of the goals of the campaign is to improve the food policies by using the day to encourage discussions about the policy change, to highlight and support local and state policies, also to educate the public, and also encourage lawmakers to introduce or support specific pieces of legislation that will improve our food system. And last year we had more than 3,200 events around the country. And we thought that this day of action can be used for something more meaningful and long term. Next slide, please. So this year, we invite you to start changing the food system on Food Day and use the momentum as a rallying point to work with the groups on the local and state level. Last year, many organizers already used Food Day to advance their policy goals. For example, in New Haven, Connecticut, the city announced its first ever food action plan to build up the local food economy and promote healthy food choices. In California, the organizers used Food Day to support Richmond's and El Monte's initiatives to tax sugar beverages that was discussed in November. And in Chicago, the Advocates for Urban Agriculture had an Urban Ag Summit, a policy convening with other groups in the city. So there are all these great initiatives, and we thought that their work can be supported a little bit more from our main office. Next slide, please. And you see here different topics we try to cover, from schools to food policies in workplaces, sugar drink taxes, restaurants, food marketing, land use and zoning, public venues, animal welfare, and many more. And you are welcome to send us your ideas. We've already received some feedback that some issues are missing, and we are planning to add them. So Food Day seeks to be a sustainable and impactful movement that will create lasting change in the communities. It is much more than one day. It has a strength to help slowly improve their local systems and their way their America eats. So We hope it will be helpful. Please send us feedback on the email on the next slide, and we'd be happy to have the conversation and see how else we can support you.
Okay, great. So at this point, I'll turn it over to Nancy Hunegarth, President of Nancy F. Hunegarth Consulting and longtime Executive Director of the New York State Healthy Eating and Physical Activity Alliance.
Okay, do you have my screen on now?
Yes, you'll just want to make it full screen.
There you go.
Great, we see it. Mm-hmm.
Okay, well, thank you so much for having me on this important webinar about advocating for food policy on Food Day. And just to get things started, I'm sure just about everybody on this call is aware how important it is to permanently alter the food environment through food and nutrition policies that we get passed at both the local, state, and federal level. Food Day really is a terrific way to highlight potential food policies that you'd like to see enacted in your community, be that your local community or sometimes even at the state level. Now, how do you highlight food policies on Food Day? Well, Lilia gave you a few examples of what has gone on around the country, and I'm going to give you a few more suggestions on how you do it. So first of all, one great idea is to ask the people at your Food Day event to sign a petition in support of a community food policy that you'd like to see passed. Very simple. Then you take the petition to your policymakers, and hopefully that moves things along. You can also hold a lobby day for your organization on or around Food Day and advocate for food policies. You can create a Food Day local panel discussion or a symposium on food policies that you think would improve your community's food system. You could also create a Food Day phone call, email, or postcard campaign asking your community leaders to introduce and pass an important food policy that you're advocating for. Another thing to do is to send in an op-ed to your local newspaper that encourages local decision makers to introduce an important food policy in honor of Food Day. You could also organize a rally on Food Day if you have a particular policy that's already been introduced. And the rally can be in support of the policy, and you could try to get some media coverage, which is always useful with a rally. And last but not least, you could hold a Food Day event where you have a local academic or supportive policymaker present a study that shows the local benefits of passing a particular food policy. And as an example, maybe how a local sugary drink tax would reduce consumption in your community and how much money it would raise for important obesity prevention programs. So that list is hardly inclusive. There's many other ways to highlight or support food policy on Food Day, and as we learn of them, we'll put them in our resources to help you. But the most important thing is that you identify a policy or policies that you think would make a difference in your community, and then you can strategize your particular Food Day plans. And now I'm going to talk a little bit about some of the 35 policies that we've put on our Food Day website. Let me move ahead here. Just wanted to start with this little cartoon. It shows you why changing the food environment through policy is so incredibly important. Some of us may think it's funny that a kid would be clueless, what an apple slice is, but there really are kids whose idea of an apple is a serving of Apple Jacks because they live in a food desert and produce isn't there. So food policy is incredibly important if we want to change the food environment, reduce obesity, and create a healthier community. First, I'm going to talk about land use and zoning. And again, all these policy categories that I'm talking about are part of our Food Day policies that are listed on the website, so you can go look at them afterwards. It's all there. Okay, so these are the actual policy recommendations that we support under land use and zoning. And I'm going to give you some examples of the types of policies that have been passed around the nation just to whet your appetite. So under land use and zoning, I can tell you that Cleveland, Ohio has secured zoning changes to protect community gardens, urban farms, and to allow the raising of chickens and bees. And Detroit has a pretty impressive zoning ordinance that requires a minimum distance of 500 feet between fast food and drive-in restaurants and schools. The sugary drink tax. I'm sure you've all heard of that. It's been quite controversial. Let me move ahead. Sorry. A number of states, cities, and towns around the country have introduced a penny per ounce excise tax on sugary drinks. New York, El Monte, California, Telluride, Colorado, and Hawaii among them. And the reason this is being introduced is because price elasticity models, which are done by people who are far smarter than me, say that the penny per ounce tax will reduce consumption by at least 15%. And if the money raised from these taxes goes to obesity prevention programs, then it's a real win-win, because you're taking the money, you're lowering consumption of a highly obesogenic group of beverages and putting it towards policies that are going to policies and practices that are going to improve the environment. So really an incredible policy, and I urge everyone to take a look at it, even though it's a tough one to try and get past. Next category is restaurant hygiene. And you saw a picture of restaurant grading. New York City has instituted restaurant hygiene grading. It's you either get a letter A, B, or C, and restaurants are required to post their letter grade prominently in their window. And I can tell you, I live about 35 miles north of New York City. I really pay attention to those grades in the windows, and if somebody doesn't have an A or a B, I'm not going in there. Next category is hunger and food access. And here are some of the policy recommendations you'll find on the Food Day website. Some examples. New York City farmers markets accept SNAP, and SNAP is the new name for food stamps. So the farmers markets accept SNAP and WIC electronic benefit cards. And for every $5 spent on fruits and vegetables at a farmer's market, SNAP recipients get a $2 Health Bucks coupon that can be used to purchase more produce at the farmer's market. So that's a 40% increase in their buying power, and a terrific policy. Another policy that a lot of people find intriguing is the Minneapolis Food Store Code that requires 3 out of 4 healthy categories of food are sold at all licensed groceries. So basically, you can't get these little groceries that sell just beer and junk food. The Minneapolis Code tells you that you have to carry healthy food. Pesticide taxes and bans are the next category. And these are some policies that you'll find in place around our nation. And Iowa, Nebraska, Washington, and Wisconsin all have enacted fertilizer and/or pesticide taxes to discourage use. And Oregon is temporarily restricting the use of 18 pesticides while it investigates the death of thousands of bees near Portland this month. And the banned pesticides are a class of pesticides that have been linked to honeybee die-offs. Animal welfare. Florida has limited the cruel and inhumane confinement of pigs during pregnancy in gestation crates. And California is phasing out the use of cramped battery cages. In essence, it's banning the confinement of egg-laying hens in a way that doesn't allow the birds to extend both wings. Not only is this inhumane and cruel, but it also breeds disease and makes our food supply unhealthy. Agriculture and organic farming. Baltimore and Kansas City have changed their zoning for urban agriculture to allow more gardening and farming in city limits. And Woodbury County, Iowa has an organics conversion policy that provides property tax rebate incentives for any farms that convert from conventional farming to organic farming. And the organic farming that they convert to has to comply with the USDA National Organic Program Standards and Regulations. And those are the categories that I'm covering today. You'll hear more about some other categories from the next speaker. And I thank you for advocating for local food policies. And we'll have a chance to have questions at the end of this presentation. Thanks so much.
Thank you, Nancy. And now I'm going to introduce Catherine Bishop, who is a nutrition policy associate with the Center for Science in the Public Interest. And I'll just get her slides up here.
Hello, everyone. I'm in the Nutrition Policy Department at CSPI. And we focus on many different nutrition policy areas, but the ones that I'm going to mention today are all areas that we focus on that also we think would be good policy ideas for Food Day. So depending on the policy project that you choose to pursue, the staff in the Nutrition Policy Department at CSPI might be able to provide support, technical assistance, or else point you to resources that would help you in your work. One area that you could focus on would be work in schools. In schools, the federal government recently released rules to improve the nutritional quality of the school lunch and breakfast programs, as well as foods that are available in a la carte lines, vending machines, and school stores. But there are still many areas that you could work on to improve the food offerings at your school, school district, or at the state level. One thing you could do is to set standards for food and nutrition education and food literacy. Currently, many schools don't have any food and nutrition education, or else it might be one part of one health class that students will have in high school, but you could establish standards so that they're receiving food and nutrition education throughout school from kindergarten through high school. You could also set nutrition standards for the foods and beverages offered or sold at school celebrations, as rewards in the classroom, or through fundraisers. It's great that we have the federal guidelines for the school lunch and breakfast program and those other foods through vending machines and a la carte lines, but there are often a lot of other unhealthy foods that are available in schools. We've heard stories of schools that will have fundraisers where they're selling things like pizza and donuts and other fast food offerings right near the cafeteria during the lunchtime. So students have the opportunity to eat those slices of pizza instead of, say, eating the healthy school lunch. So establishing nutrition standards for those types of foods would make sure that the foods that are available during the school day are healthy. And CSPI does have fact sheets for including alternatives for those different types of foods that you could use. And you could also set nutrition standards for food marketing in schools. Students are exposed to enough food marketing in the rest of their lives through TV commercials, ads online, cell phone apps that are put out by food companies, and many more ways. And one thing that you could do is work to implement a policy at your school or school district to get rid of marketing of unhealthy food products during the school day. Currently, all schools are required to have local wellness policies, but in many cases, these policies are either weak or they're not being implemented. So one thing that you could do is to work with your school district to improve your local wellness policy to ensure that it has strong nutrition and physical activity components. And then after your district has that strong policy, you can work to make sure that the wellness policy is fully implemented at each school within the district. The three ideas that I mentioned on the last slide, food and nutrition education, nutrition standards for celebrations, rewards, and fundraisers, and marketing in schools are all different policies that you could incorporate into a comprehensive wellness policy, as well as many other things. And at CSPI, we have a model wellness policy that people could use as a resource. If you're more interested in working at the state level, one thing that you could do is to work with your state to create a plan to implement healthy nutrition environments in schools. Again, it's wonderful that the federal guidelines have come out for schools, but if those guidelines aren't being implemented in each school in your state, then they're not going to be helping students. So a state plan would help states to think about all of the different components that are coming out of the federal government and also different school food policies that have come out of the state government and think about how they're going to get those implemented in all of the schools in the state. And at CSPI, we also have a variety of technical assistance tools that would be able to help people with state plans. Another area that people could work on would be in the workplace. So one thing that you could do would be to establish nutrition standards for vending machines or food service in your workplace to ensure that healthy options are available in your workplace. We have model vending machine standards, implementation tips, and other resources that would be able to help people in this area. Another thing you could do would be to adopt a healthy meeting policy. At CSPI, we're currently working on creating healthy meeting guidelines and a toolkit to be able to help people who want to focus on this. And the toolkit is going to try to make having a healthy meeting a really easy process. So it will have helpful advice like how to negotiate with a hotel or catering company, how to talk to the caterer or restaurant about making their offerings healthier. You know, if you want to reduce the sodium in the meals that you're providing, you would be able to have different things that you could ask the chef specifically. And it will have lots of other helpful hints like that. So that should be available later this fall for people who are interested. And another thing that you would be able to do is to work on providing calorie labeling for the food service and vending machines in your workplace, so that employees would be able to make informed decisions about what they're eating while they're at work. In terms of government and public venues, you could work at the state, county, city, or community level to try to implement nutrition standards for all of the foods and beverages that are sold and served on government property. Governments are already working on obesity prevention, but in order to really walk the walk, they need to be providing healthy options on their property. And the different types of food service could be vending machines, concession stands, cafeterias, or focusing on meetings and conferences that governments host. And you could cover areas like agency buildings, parks around the state or in your community, highway rest stops, hospitals, universities, correctional facilities, community centers. There are a lot of different spaces that you could cover by working with your government. Some of the policies that you could do, for example, would be to prohibit the sale of sugary drinks on city property, Or else, in addition to having healthy food requirements, you could also require that a certain percentage of the foods provided by government be locally sourced. And at CSPI, we're doing a lot of work in this area, so we have a variety of resources that people would be able to use to help them in their work. Another area that people could focus on would be restaurants or food service establishments. So you could work at the town level, the city, county, state level, or else you could be working with individual restaurants or restaurant chains in your area to establish different policies for restaurants. One of the things that you could work on would be to improve the default items that are offered with kids' meals. Currently, kids' meals generally come with French fries, a fried chicken item, and a soda, or else French fries, a cheeseburger, and a soda, which really aren't healthy, nutritious meals for kids. But you could work with the restaurants to make sure that the automatic default items are healthier. So have the side dish be a fruit or vegetable option instead of being the French fries, or have the default option for beverages be a low-fat milk or water instead of the typical soda or juice drink that comes with kids' meals. Another thing that you could do would be to establish food standards for the kids' meals that can have a toy sold with them. Food and beverage marketing, including toy giveaways, have been shown to influence children's preferences, food choices, diets, and health. And a national study that was done showed that 97% of kids' meal combinations at the top chain restaurants around the country don't meet expert nutrition standards. And 91% of those meals don't even meet the nutrition standards that were established by the National Restaurant Association. So setting up nutrition standards for children's meals that offer toys would be a way to support healthy choices for children by encouraging restaurants to provide healthy options, limiting the marketing of high-calorie, low-nutrition foods to children, preventing companies from undermining parents' efforts to feed children healthfully, and supporting parents in choosing healthy meals and snacks for their kids. Another area that you could focus on would be menu labeling. So listing the nutrition information right on the menu or menu board so people have that information when they're ordering their food. Menu labeling rules will be coming out of the Food and Drug Administration later this year for restaurant chains that have more than 20 or more restaurants nationally. But you could be working with non-chain restaurants or restaurants that have fewer than 20 chains nationally to try to get them to have the same type of menu labeling so that people can make informed choices. Another thing that you could focus on would be to work on banning the use of artificial trans fats in restaurants. Many restaurants have already eliminated the use of artificial trans fats, so they've demonstrated that there are many cost-effective alternatives that restaurants could be using, yet there are still restaurants out there that haven't made this switch. So you could work with individual restaurants. Again, you could work at the state, county, or city level to try to make restaurants make this switch. And then finally, you could be working on different food marketing issues. So one would be to work with whatever level of government that you'd like to work with on adopting nutrition standards for the foods that are advertised in government facilities and on government property. So this could include parks or the scoreboards at the local baseball field or other spaces like that. So really any government facility or property. And as I mentioned on the last slide, you could also focus on having nutrition standards for the kids' meals that have toys, or you could focus on establishing nutrition standards for the foods that are marketed in schools or on school property. So those are some of the policy options that you could pursue for your Food Day event or as part of Food Day. And next.
Yeah, so we're waiting for our third presenter who's experiencing a little bit of technical difficulty, but in the meanwhile, I just wanted to remind everyone that this list of policies is actually available on the Food Day website at foodday.org/food_policies. And we'll send that link around again in the follow-up email. But we're really advertising this as 35 ways you can get engaged. And again, Katie was outlining some of these areas in which you could get involved and ways to actually pursue those policies. And what would be the best resource through nutrition policy, our nutrition policy department, for people to find some of the guidelines on healthy procurement and schools?
So one of the places to start would be looking at the policy list that's on the Food Day website and looking at the resources that are available there. And those will bring you to the different websites on the CSPI page that focus on these different topic areas. And once you get to those pages on CSPI, then say, for example, you're looking on our food marketing page and you open one of the fact sheets we have there. Then at the bottom of all of our fact sheets there is a contact person. So then you would be able to be put right in contact with the person who works on that topic area. So I think that would really be the best way.
And which of these are your specialty areas so people know?
So I specifically work on healthier food choices for public places. So I would be working on the workplace policies and then also the policies for government venues and public property.
Okay. So yeah, for those of you out there who are involved in food policy work already, it'd be interesting to hear from you at this point if you have any questions on the policies that were presented or possible additions to the list. You know, we'd love to get your feedback on this food policy toolkit and hear more about what your how you're engaging with policy and maybe any particular best practices or models that you have. So I'll put that out there as a sort of question for the audience to think about for our Q&A session. And it looks like we've been joined by Louise Mitchell, who is the regional organizer with the Healthy Food and Healthcare Program at Healthcare Without Harm. Louise, are you there?
I'm here.
Great. So I'll turn it over to you, Louise, and are you ready to share your screen?
I'm ready, yeah.
Okay. So Louise is engaged in policy on the state level, and we're really glad to have her on the call today to describe a little bit more about her policy efforts in particular.
Thank you very much. Can you hear me?
Yes, go right ahead.
Okay, and you can see my slides?
Yes.
Okay, great. So thank you for having me on the webinar. I appreciate this opportunity to share with you what we're doing in the healthcare community around the country. So Healthcare Without Harm is an international coalition that engages hospitals in sustainability initiatives, and we have a national healthy food and healthcare program as well that engages hospitals in healthy food initiatives. So in looking at why we engage hospitals in this work, first we obviously have a national crisis of diet-related chronic disease, and so it's important to engage healthcare in addressing that and doing their part, as many of us are already. Another is that we educate hospitals in the connection between our industrialized food system and human health and environmental health and the risks to human health. Another reason that we have selected healthcare to work with is because healthcare obviously is a very large purchaser of food. They're open 24 hours, 7 days a week. They serve a significant number of employees. Actually, usually 3 or more times the number of employees are served food than patients. They also obviously serve patients, and that's their primary reason for existing. And so we certainly want the patients to have healthy food. And we want hospitals to also take responsibility for providing a healthy food environment and to look at their purchasing practices and to purchase foods that are produced in a healthy way that promotes not only health for the people that eat the food, but promotes public health. And certainly hospitals are community leaders, and they're now being called anchor institutions in the community because they are large employers and provide services to the community and are pretty stable employers in communities where other businesses may be not so stable. My slides are not advancing. No. There we go. So we define healthy food in healthcare as we define healthy food as not only food that's more nutritious and whole food, but also food that comes from a food system that's environmentally sound, economically viable, and socially responsible. We have many strategies. We engage hospitals in participating in food policies, not only passing them at their institutions, but also in their professional associations and at the state and federal level for public policy. We also engage hospitals in purchasing, most importantly, procuring local and sustainably produced foods. We work with them on changing their menus, support them in launching farmers markets, CSAs, and gardens. We have a significant healthy beverage initiative that includes beverages in the cafeteria, patient meals and nursing units, as well as in the vending and catering. And we do a lot also with sustainable initiatives in hospital food service, which includes composting, waste reduction, energy efficiency, reducing chemicals, reducing harmful chemicals used in the food service department for dishwashing, cleaning floors, et cetera. So it's a broad sustainability initiative. This is a sample of our primary programs. We have a Healthy Food Pledge, which is a commitment that hospitals sign onto to agree to purchase and serve more local sustainable foods and implement sustainable food service. There are no specific benchmarks or timeline with the pledge. It's just a public commitment that they sign on to, saying that they'll take gradual steps. We have our Food Matters program, which is our training for clinicians to educate them on the food system and the links between food production practices in industrialized agriculture and how that impacts human health. And we also engage clinicians in being advocates for healthy food initiatives at their facilities and also policies. We created the Green Guide for Healthcare with Healthcare Without Harm and other partners to have tracking tools that hospitals can use to document their progress. Our Balanced Menus initiative is an initiative to reduce meat purchasing, in particular beef, pork, and poultry, because of its impact on climate change, its impact on environmental health because of production practices, and to provide healthier meals. And the second part of Balanced Menus is to have hospitals use their savings from reducing meat on their menu to purchase more local and sustainably produced meat, which has been a very effective and powerful strategy to engage them in shifting towards these kinds of purchasing practices for meat and poultry. We have the Healthier Hospitals Initiative, which is a campaign. It's a national campaign that hospitals can engage in to reduce waste, chemicals, safer purchasing, reduce their energy use, and implement healthy food initiatives, including reducing meat, healthy beverages, and local sustainable food purchasing. And then we have our Healthy Beverage Initiative as well. We host conferences, webinars, trainings, and have a very developed website. And all of these links and events are very useful resources where you can find a lot more information. As I talked about our pledge, we now have over, actually this says 250, should be 450 hospitals throughout the country that have signed the Healthy Food and Healthcare Pledge. and it's an easy first step for hospitals to take. We have a lot of tools and resources that support hospitals in not only increasing their procurement of local sustainable foods, but in starting to implement policies, either at their institution or participate in promoting and supporting public policies. So I'm going to now share about some of the policy initiatives we work on. So we provide hospitals with resources and model policies that they can utilize or revise to specific to their institution. And there are a few different levels of policy. There are policies that the hospitals can adopt that are more broad sustainability policies or vision statements or mission statements. Some call them guidelines. And different hospitals and health systems adopt these policies at different levels, but certainly we want hospitals to have these in writing so if there are staff changes, the policies and the practices will remain, even though a passionate champion might leave the hospital for another position elsewhere. We have hospitals, this example shows Rady Children's Hospital passing a mission statement and a charter for implementing sustainable initiatives, which can include, and usually do include, healthy, local, sustainable food. We have some hospitals that are being more specific about their policies. So, for example, some are implementing procurement policies on their meat and poultry, or in this example, just poultry. And the ultimate goal is to have it be a third-party certified product that they purchase to verify the practices, ideally, although that's not often realistic for the small-scale farmers locally. Ideally certified humane, raised and handled, or humane practices used, and of course locally or regionally purchased. Our definition in healthcare of local food is within a radius of 250 miles because this is really what's realistic for hospitals to purchase in working together with their distributors, both national distributors and regional distributors. This is what's realistic within their capacity and their distributors' capacity right now. And then we support hospitals by providing definitions of what's sustainable and prioritizing the criteria of sustainability and sustainable foods. Another more specific policy that some hospitals are passing at their institution, in this case it's Steward Healthcare. They passed a healthy beverage guidance document or initiative and outlined their specifics of their steps and their goals. We also have healthcare providers working together with their health professional associations to pass resolutions or policies. So, for example, the American Medical Association passed a resolution in 2009 to support sustainable food systems. The American Public Health Association passed a resolution in 2007, and the American Nurses Association passed one in 2008. And so this helps to guide their profession, their members of their profession, their professional association, and it also can be utilized when we're wanting healthcare professionals to be advocates for a policy either at their institution or public policy. They can demonstrate and give these examples of their professional associations actually passing these resolutions. So it helps to provide some good credibility for help make the case. We have hospitals that are signing on to very specific policies, public policies. So nationally, there has been legislation for several years to ask the federal government to pass a policy that eliminates the routine use of antibiotics in animal agriculture, most especially human antibiotics that are used in human medicine. And that the acronym for that legislation is called PAMTA. And there's also another complementary legislation right now that's called PARA. Those are acronyms for their PAMTA is the Preservation of Antibiotics for Medical Treatment Act. So as you see in this press release in 2010, we had over 1,000 physicians and other clinicians sign on to this sign on to a letter in support of passing this legislation, and we had over 60 healthcare facilities sign on, and another 300 hospitals. 300 hospitals at that point had signed the pledge. So this is to demonstrate the healthcare voice and healthcare professional support for these kinds of legislation passing. And in Maryland, Maryland is the first state in the country to ban the use of arsenic in chicken feed, and healthcare was instrumental in helping to get this legislation passed in collaboration with many other partners that have been working on this actually it took 3 years to pass this law in Maryland, and that was last year in April 2012. So in Maryland, the healthcare sponsors included 4 professional associations of pediatricians, doctors, nurses, and dietitians, and we had 2 hospitals sign on and many individual clinicians sign on. In Maryland, there's also a proposed pesticide policy that was implemented this past January, and on that legislation, Maryland had 140 individual healthcare professionals sign on, 1 hospital, and 2 health professional associations. They were for physicians and pediatricians. And there are other policies and legislative initiatives that we've engaged healthcare to sign on to. In the spring, we had hospitals sign on to the comment period that the FDA had opened for the question of making it legal to have genetically engineered salmon in our food system. We have engaged hospitals in signing on to the Farm Bill, and we also engaged them in not only passing policies at their institutions, but also writing into their contracts with their distributors, with their group purchasing organizations, or with their food service management companies. The 3 biggest ones include Sodexo, Morrison, and Aramark. So engaging those vendors to pass policies that support healthy, sustainable food purchasing. So ways that Food Day organizers can coordinate with Healthcare Without Harm and engage healthcare in your communities in supporting policies include: you could reach out to a healthcare regional organizer. We have about 13 in various regions throughout the country, but we are definitely not in every state yet. So if you check our Healthy Food and Healthcare website, you can see the list of regional organizers, and I am one of those regional organizers in the U.S. You can also look on our website and see the list of hospitals that have signed the Healthy Food and Healthcare Pledge, or that have signed onto the Healthier Hospitals Food Challenge, and you can identify the hospitals in your region that have already made a commitment, a public commitment, to take steps in this direction. You can coordinate with Healthcare Without Harm to engage hospitals and healthcare professionals in your campaigns, or we can team up together and work on them. You can also introduce hospitals in your region to sign on, like make them, if they're not already aware of our program, the Healthy Food and Healthcare program, or our website or resources, you can inform them about that and connect them to us so we can support them in these kinds of initiatives. And you can also invite them to sign on to our most recent campaign to have healthcare professionals sign on to our antibiotics letter, which is PAMTA. We have a Protecting Antibiotics toolkit if you go to protectantibiotics.org, or actually even more specific to healthcare providers, you can have them go to this link on this slide and actually have them sign. They enter their zip code, they'll get directed to their specific elected officials, and they can sign on to the legislation to support the antibiotics legislation. These are additional resources that you can use to help you take note of policies and get some kind of support and templates for policies in healthcare. And then this is a link to our regional organizers. And also we have leadership councils, work groups, and alliances where healthcare is working together with various other stakeholders in the food system to not only pass policies, but to help to facilitate more local sustainable food purchasing.
Thank you so much, Louise. And that was really helpful as a way that Food Day organizers can with food policy, especially through healthcare without harm. I am going to turn it back over to Katie Bishop for a moment to make a few additional comments. And while she's doing that, I'd love to have the audience type in any questions or comments so we can address them in the next session.
I wanted to say that for people who haven't worked on policy issues before, and you're a little bit apprehensive to start, it doesn't have to be as scary as it might sound to begin with. You don't have to start by doing a big lobbying campaign at the state level. I mean, obviously, if you'd like to start at the state level, we'd welcome that. But it could be as simple as starting by just talking to your HR department about having a healthy meeting policy in your workplace, or going to the Parent-Teachers Association meetings at your child's school and talking about the policy that you want to change in that school, starting it there, or just setting up a meeting to talk to a member of your city council. So it doesn't have to start as a big campaign already, but just start by talking to some of those key people. Or else you could reach out to some of the people who have been on the webinar today, and we might be able to link you to somebody who's already working on the area you're interested in your area, and you could talk to them about supporting their efforts and making that part of Food Day.
Thank you, Katie. Yeah, I think that's an important point, that you don't have to be involved with a previously existing policy organization to actually help advance better food policies. So, all of you out there who are thinking about ways you can improve the food system, there are definitely ways to get involved as an individual as well. So we have a couple of questions here, which I want to start with. One is from Emily Gaddis, and she's asking generally about, will Food Day help to promote fundraising efforts by start-up mom-and-pop grocery stores that provide environmentally friendly and socially responsible food? If so, how can interested businesses submit their profiles? And Emily, one of the ways that Food Day does help to lift up some of these, businesses that are trying to source healthy, affordable, and sustainable food is the sort of free promotion aspect from being involved at foodday.org and posting an event on our map at foodday.org/host_an_event. And by doing that, you will actually be exposed to our entire Food Day network, who are searching for events on our map leading up to October 24th that they can attend and get involved with. And an event can be as simple as, we're having a special menu item for this day. We're promoting our healthy initiatives by putting up signage in our stores on Food Day to let our customers know what we do to source healthy, affordable, sustainable food. Hosting a community potluck, or getting involved with some of the activities you heard about today on a policy level, advocating for a local business, the local business community to get involved in talking about sustainability issues with city council members, or making it a priority at the local level in the government. So there are a lot of ways you could get involved with Food Day. Like I said, one of them is posting an event. You could also send us a blog about your business and how you'll be involved in Food Day. And you can get in touch with us to be connected to other folks in your area to connect with them and collaborate as well. So thanks for the question, and I hope that addressed it. If not, feel free to email us at foodday@cspinet.org, and we can talk more. Maurice Hausner asked, can we get email addresses for speakers? So yeah, I think we can share the contact information of our speakers, Louise and Katie and Nancy, so that if you have questions specifically on their presentations, you can just get directly in touch. And then Eric Curran wrote in, I'm a city council person in Staunton, Virginia. For the last year, I've convened a food policy task force. This fall, we're taking policy proposals we've developed to the city council. Do any of your groups offer speakers available to speak in favor of our initiatives, either to the public or to testify in front of the city council? So that's a question, I guess, for Katie, Louise, or Nancy. If you know of speakers or folks who could give testimony particularly on some of these policy initiatives.
And in what state was that?
In Virginia, Staunton, Virginia.
This is Katie. I think that part of it would depend on what the policy proposals are. I know that in what I work on, we do have we do grassroots organizing sometimes for different policy proposals. So we might be able to find people who are already in your community who might want to testify, or else be able to write written testimony if they can't testify in person.
And this is Nancy. What Katie said about finding people in your own community, as the executive director of NYSHEPA, I've gone county by county trying to get food policies passed. And we do a little bit of research about the counties, and we find organizations there that might be supportive of the policies. Usually the organizations are health organizations like your local chapter of the American Academy of Pediatrics, the American Cancer Society, the Diabetes Association, the Heart Association, the YMCAs. So if you haven't already looked at those local groups for some assistance there, I would take a look at them before you even bring in an outside expert to testify.
And Louise Mitchell also added that she does know folks in Virginia. So Eric, we'll send around the contact information for the speakers, but definitely get in touch with Louise. And be there, Louise.
Yes, I can also assist with finding a speaker to testify or educate, through the healthcare community and our contacts.
Great, thank you. Okay, any other questions from the audience or comments you'd like to make? Food Day plans to offer some technical assistance on these policies, so really feel free to get in touch with us. We'll try to connect you to folks who can help with your policy initiative, and we hope that you'll use Food Day this October and the day itself, October 24th, as a chance to launch an initiative or report back on an initiative that was launched in a previous year, address food policy with your city council or with the local mayor. So this is really an opportunity for you to use Food Day as a chance to build momentum and take advantage of this moment in the national spotlight. There were 3,200 events and activities around the country last year in all 50 states, and we're going to have even more this year. So it's really a chance to focus the lens in on better food policies and work to advance your goals alongside hundreds of thousands of other Americans. So please do check out our website, foodday.org, if you haven't already. You can find the archived recording of this webinar as well as our other webinars at foodday.org/webinars. And we'll be sending out the registration link, the recording link and the slides to all of the registrants after this call. So thank you to everyone for joining, and a special thanks to our presenters, Nancy Hunegarth and Louise Mitchell and Katie Bishop.